Hello, everyone. Thank you so much for joining us for this important educational workshop on colon cancer prevention and healing. I'm honored to have my friend and colleague, Tim Burke, join us and share his story about his cancer journey and fighting disease and now maintaining his health post-remission. I wanted to get started with colon cancer, just an overview. Colon cancer is the second deadliest type of cancer in America. Over 50,000 people die each year from this disease. However, most of these deaths are preventable with early detection and proactive care from both functional and conventional medicine approaches. There's some risk factors. Basically, it affects all races, genders, and ethnicities. If you have a personal history of irritable bowel disease like ulcerative colitis, Crohn's disease, or diabetes, then you are at increased risk. Family history is important, but 25% of colon cancer is hereditary. The other 75% is not hereditary. So even if you don't have a family history, that doesn't mean you're not at risk for colon cancer. And then lifestyle is very important. So we know that the standard American diet is a risk factor. Sedentary lifestyle, obesity, smoking, and alcohol intake are all risk factors. So is toxin exposure, like pesticides on your food, environmental toxins, endocrine disruptors, which would be like products that you put on your body that aren't organic. And then other important things to look at are your oral microbiome as well as your gastrointestinal microbiome, because research has shown some bacteria, such as one called Fusobacterium, that has been linked to increased colon cancer risk. So we can find that on the saliva testing as well as stool testing. So if we see it, then we definitely want to knock out that bacteria with either herbal protocols, mouth rinses, and targeted probiotics and all that kind of stuff. So those are all things I can do here. And then we know that colon cancer is on the rise in the younger age group, especially under age 50. It used to be around 11% of all colon cancer incidents. Now it's gone up to 20% of the colon cancers that are being diagnosed are in people under the age of 50. So that's why the organizations have prompted earlier screening. So now it's recommended to get your screening by age 45 instead of 50 like they used to recommend. And then symptoms to look out for would be changes in bowel habit, like specifically more constipation, feeling like you're not able to fully evacuate, or if you notice that the caliber of your stool is getting more narrow, like pencil-like, rectal bleeding, blood on the toilet paper, blood in the stool, any of that is a red flag. Unexplained weight loss and just abdominal pain, bloating. So any of that, you should start questioning, do I need to go get screened? And if you're 45, then the answer is yes. So from a functional medicine perspective, we always are trying to find the root cause. So if you work with me, we look closely at your diet, lifestyle changes. If you have a history of colon cancer, then we would put you on a keto or low sugar diet. We would definitely get rid of the alcohol. That's another big risk factor. And then working on stress management, microbiome optimization, lowering inflammation with some targeted supplements like resveratrol, turmeric, optimizing vitamin D. Like we definitely want to get your blood levels between 60 and 80. And then we also know that turkey tail is a mushroom supplement that improves your immune system. Optimizing your nutrients like the Mediterranean type diet, but a low glycemic version. Exercise, trying to get to your ideal body weight and maintaining it. And then just keeping up with your screenings, either doing a colonoscopy or a Cologuard. I know Tim feels strongly about the colonoscopy, and I'll let him talk about that more. I do have some patients that have a lot of anxiety about colonoscopy, and that's preventing them from doing anything. Like it kind of gets them in a freeze state. So for those people, I'll tell them I at least want you to get started with the Cologuard. Like if you're not going to do anything, then we got to start with the Cologuard because that has a 92% sensitivity. It's not perfect. I mean, there's no perfect test, but as long as you're not high risk and you're not actively bleeding, then you could start with a Cologuard just to see. And if that shows abnormal cancer cells or blood, then we still will have to refer you for a colonoscopy. And one thing that I've learned when I've been doing research about this is if you get sent to a GI doctor with a positive Cologuard, when they do the colonoscopy, they are much more thorough because, now it's on them to make sure they don't miss cancer. So they're going to spend more time. They're probably going to take more biopsies. They're going to look in every little crevice. And if you get out of that procedure and it's negative, then hopefully they've done a really good job because you can have false positives on a Cologuard. Like if you collect it during your menstrual cycle and there's some blood, or if you have hemorrhoids and a little bit of blood gets on there, those will show up as a positive Cologuard. So then you have to get the colonoscopy. So like I said, there's no perfect test, but those are the two different ones, and I'll go into a little more detail on that in a minute. So now, for example, if you do get diagnosed with colon cancer, what do you do to increase your chances for survival? So there are a few things you can do to make chemotherapy more effective and less side effects. There's some research showing if you do a 3-day water fast prior to chemo, or the Prolon. I put a lot of y'all on Prolon, which is the fasting mimicking diet. There's a lot of data out of USC Longevity Institute about Prolon. If you do that the 5 days prior to chemo, it helps you kind of clean out your system, and your body's in ketosis at that point. And then when you do get the chemo, it's supposed to work better with less side effects. So these are all things that they're doing research on right now, but there is promising data showing that fasting before chemo has good outcomes and decreases side effects. But I know people are worried about losing too much weight, so you have to kind of balance the risks and benefits of that. But now I wanted to kind of introduce Tim and have him tell us more about his journey with colon cancer and his story about survival and all the things he had to do to get to where he is today.
Thank you, Dr. Engels. Thank you for having me today here for the workshop. And it's fantastic to be here with everybody. And I'm on the other side of the workshop now. I get to actually be on the workshop, which is great. My cancer journey started at the age of 45. I went in for a routine colonoscopy, but I did have some symptoms. I had some blood in my stool. But I was 45, and I didn't ever think that I would be diagnosed with cancer. Being a pretty healthy person, marathon runner, college soccer player, a very active lifestyle. So when I started having some blood in my stool, then, obviously that was concerning. I didn't know if it was hemorrhoids or what it was, but then I scheduled a colonoscopy, and it took a while. It took like 3 or 4 months to just get in. So obviously, if you are having any symptoms or any signs, get on top of it quickly, because you never know how long it would take to get in to see a GI doc to help you, so you can get your colonoscopy. But for me, my great grandmother had colon cancer, so it's hard to tell, right? How do you know that it's going to happen to you? I think that's the big question. It's like no one ever thinks it's going to happen to them, and then all of a sudden, here you are, you get this diagnosis, and then you start researching, and that is like when you go down the rabbit hole of realizing just how serious the disease is.
Tell us more about all the things you went through, and just so people can kind of relate a little bit.
Yeah, so in April of 23, I was diagnosed with stage 3A colorectal cancer. So that means that the cancer had made it through the muscle wall, but not outside of the mucosa. So the initial survival rate was 80% 5-year survival rate, so pretty good survival rate. Uh, and the procedure that they performed on me within a month of diagnosis, so at the end of April, they did a robotic colectomy. So they made several incisions. I think it was about five, and they went in with a robot and they resected the sigmoid colon, and then they rejoined the colon, and that juncture is called an anastomosis site. So uh, after that surgery, I honestly didn't have any big scars, which was kind of nice. I mean, it was laparoscopic, so it's amazing what they can do with the technology. However, I do have a comment to make on that maybe later, because I don't know if technology is always as thorough, as we would hope it would be. But after that, then I did 3 months of chemo, so 6 rounds of chemo, and the type of chemotherapy that I did was oxyplatin and Folfox, Fury, or Folfox. So it was like a combination of therapies, and I got really sick. I was very nauseous. It was a tough 3 months, and then after 3 months, I met with the oncologist, and he's like, "Hey, congratulations, you made it through it." I think he said you're cancer free. So which was like, I mean, oh, okay, cool. That would be fantastic, right?
Yeah.
One of the diagnostic tests that they implemented was called the ctDNA test. And the ctDNA test looks at the tumor. If you have cancer, it cancer or tumors tend to shed DNA, so it picks up on the DNA shedding from the tumor in the bloodstream, and they can detect it, which is a really good test for detection.
So
And
that's
then you have
that's a blood test, right?
correct, yeah, yeah, it's a blood test. So then once you detect it, you have to figure out, okay, what next. So unfortunately, 2 weeks, 2 to 3 weeks after I stopped chemo, they did the test, the ctDNA test, and then I realized that the cancer wasn't gone because the test showed that there was you know the little dot. It was up above the zero line. That's not where you
Yeah.
want it.
Right,
So
right.
so that kicked off a series of different appointments, and one of them was a PET scan. And in the PET scan, they do a radioactive glucose, and the way that cancer metabolizes sugar shows up differently. It shows up like a big highlighter if there is active cancer, and lo and behold, when they did the PET scan, it showed about a thumbnail size nodule on the anastomosis site. So then it was like, okay, what do we do? We do chemo or do we do surgery? So we elected to do a diagnostic laparoscopy and go in and remove the cancer from the anastomosis site. How it got there, we don't know. Did they not get it all? Was there surgical seeding? I mean, there's a lot of different things that can happen. So it's a bit of a mental roller coaster as you're going through this. You know that it's not good if it comes back. Let's just put it that way, right?
Right.
So statistics tend to go the wrong direction when cancer doesn't go away the first time.
Hmm.
So they did the procedure. Once again, they went in laparoscopically, removed the nodule, and then about 3 months later, so this would be the spring of 2024, I got really ill, and I thought it was a common cold, like a flu, whatever. I started sweating and feverish, and went in for. It was about the time I had another PET scan. Went in for my 3 month PET scan, and unfortunately, it showed that there was a fairly large mass down right close to the anastomosis site. So the cancer had come back, but to make matters worse, the there was there was a leak in the colon, so it created a large abscess, and we didn't know if it was the cancer was getting really big really fast, or if it was the abscess that was growing, because you don't want infection in your peritoneal liner. You don't want bowel getting into the peritoneal line, into the sterile space. So extremely scary. I was really sick. I didn't go septic because I'm still here, but I wouldn't have made it if I would have. So I was in the hospital for about 10 days. And once it took us about, is surprising, it took about 2 months to get the infection under control. So I was in and out of the emergency room. My sister saved my life at that during that time because she came home and said, Tim, you have to go to the emergency room. I don't know if I would have, because I was already frustrated with having to go to the hospital a lot.
Yeah.
So for anybody listening out there, let your loved ones help you,
Yeah.
uh, because often they can see things you can't, and you can't expect yourself to see everything and know what to do. There's just no way. So once we got the infection under control, they were able to stop the abscess from growing. They had to go in and put a drain in it. They drained the abscess. But unfortunately, the mass was still there, and the mass was growing rapidly. It went from the size of a racquetball to the size of a grapefruit. It was very eerie to have a tumor poking out of your lower abdomen. So just put it that way. Hopefully, that's not too graphic for everybody listening, but just incredibly scary. So then I went back on chemo in June, and then I went through 12 cycles, so 6 months of chemo, and that was June through the end of October. Before they did a big procedure on me to remove the tumor called cytoreductive surgery, and that's when they actually make a pretty big incision. I don't know. I mean, it was like, I think it's over a foot. It's 50 stitches. And I want to say something here for anybody who watches or is listening. Dr. Engels was incredibly helpful through all this. Her dad is actually a colorectal surgeon. And there was wisdom that I got from listening to her and like, her family story. Like, how would your dad have handled this? That gave me more confidence that a maybe I thought of it like a more old school style of doing things may actually be just as effective or more effective, because the surgeon can go in and actually look around. And if I didn't want to get opened up, no one wants to get opened up.
Right.
But the procedure I had in December, they opened me wide up, and the surgeon was able to go in and remove the mass. The cool thing is, uh, they used some targeted therapy that was able to kill over 99% of the tumor and the cancer. So they only found just a tiny little trace, and they were able to successfully remove the tumor with good margins. So that was really good news, and reattach me.
Yeah.
So for anybody that doesn't know, like, your bowel, either they can reattach it or you get a bag. So fortunately they were able to make the connection. And I remember my mom and my sister, who are both medical professionals, being so encouraged, because they're like, man, that would be so tough as far as a lifestyle change.
Right.
So I've been through a lot, and it has been an intense 2 years. So that's why I'm so passionate about people getting in and getting their colonoscopy. Please do not wait and do not mess around. It is not worth it. It is so much easier to go in and get it, the prep, whatever. That stuff is simple. Call me if you need to chat through it. I will love to help, but gosh, the stuff I've been through, you don't want to go through. If you have a loved one or friends or family and they're 45 or older, they need to get their colonoscopy done.
Yes, and like I said, if they're stuck and scared of it, they can start with the
Yeah.
Cologuard and then get the colonoscopy the next time. But because I have patients that won't do a colonoscopy, so I can bargain with them to at least start with a Cologuard. But I wanted to ask you, looking back prior to your diagnosis, were there some lifestyle changes you wish you had made earlier, or was there anything you were doing that you think impacted your risk for colon cancer?
I think that yeah, I mean, I have laid in bed at night and thought like, what could I have done better? I don't think I really focused on having a high fiber diet. I knew it was important, but I didn't realize that that could be a contributing factor or increased risk of colorectal cancer. Not, I like vegetables. I just don't know if I always really thought about having them with most of my meals. you know, as someone that's an athlete, like I ate a lot of protein, made sure that was a priority. But I would say eat a lot of fiber.
Yeah.
You know, get good rest. I think that one of the enemies that I've faced is being driven and trying to accomplish a lot. Like feeling, it's a very American thing to be, type A and try to be, be successful. You work hard, and I'm not saying that those are bad things, but what's unhealthy is when you don't give your body a chance to rest. I think I pushed myself too hard. I think, I was surviving off sometimes 4 or 5 hours of sleep. And I think that was really foolish looking back. I think alcohol consumption, I liked having a beer when I'm out fishing with the guys and doing some of that. But still, as I became older and it became more socially a bigger part of business and meeting with people and having a glass of wine or going out for a happy hour, you don't realize that you consume a lot of alcohol over
Right.
time, and I don't think that's healthy for us. And I think the thing that's really stood out to me is we don't really know who's how do you know your immune system is better than the other person's? Because I think, and Dr. Engels, you can speak to this, but I think it's an immune system failure, right? Because the immune system can't see the cancer cell and recognize that it's bad and attack it and kill it. That's why it is successful in the body when you don't want it to be, is because the immune system's like, just surpasses it. So I would love to know what caused my colon cancer. If we could pinpoint it, then obviously you would want to remove that.
Mm-hmm.
But as I look back, I think back through my life, there's things that I would do differently.
And how did you cope with the emotional and psychological challenges of your cancer journey?
Great question. Having good support is so important. So I would say my number one support structure has been my faith. There's so many nights I laid in bed and just asked God for mercy, just to let me live. I mean, it's just honest. And I'm like 45. I don't want to go yet. There's things I'd like to do. My, my family's been incredibly supportive. Flying up from California, my mom flew up every month to go to my treatments and be there for me. My sister is also a healthcare professional. There's a lot of my appointments with me. Friends came to my appointments. Just having someone with you and it's really important that people are there if you have to go through a nightmare like this, because then they understand you. So if you're a friend that's listening and you know someone is going through there, one of the best things you can do is show up, and just be there. You may not know what to say, but just being present is so powerful, because then the person going through the nightmare struggle feels like at least you understand. You've seen, them hook, you know, a line to your port and dump poison in your body, to try to kill something that's trying to kill you. So
Are there any specific self-care practices you prioritize now to maintain your emotional health and stress management?
yeah, if I was just kind of roll through the bullet points, it'd be, my faith's number one, my family, regular activity. I walk 2 to 4 miles every day. I'm in the gym, 3 to 4 days a week. My work is really important to me. Working with Dr. Engels and my other clients, I feel like they've been a lifesaver to me because they've given me something really valuable to focus on. What's beautiful about my line of work is I get to help doctors help other people. So I feel like I'm kind of in there helping too, right? I don't have a medical degree or a mind for medicine in that way, but I enjoy being able to help on the business and communication side of the clinic. So that's been really important to me. I've been very intentional on my diet, what I put in my body. And I think a lot about it now more. And then I try not to judge, but I realize how much junk people put in their bodies. I'm like, oh man, I hope everything holds up okay,
Yeah.
right? So I've cut anything that I believe would be toxic to me out of right now. I want to get past 2 years. We've got past some really tough hurdles so far, and I'm surviving.
Right.
Which is I'm very grateful to be here. So
And so, what does wellness mean to you now? Like, how has that definition evolved since your diagnosis?
yeah, I think that once again it goes back to thinking through what you consume, how you prep your meals, staying active, really resting, prioritizing the things that are really important is meaning my family, friends. Just you have to kind of think through when your life may not go that long, or as long as you expected. Who knows, right? You really think back through your priorities, and so wellness for me is really readjusting my priorities and focusing on the things that are the most important. And that means sometimes you have to sacrifice other things that are just not as important. And because you don't know how much time you have. So I tell people that when you have to fight for your life and you have to fight cancer, you lose that kind of innocent bliss that a human being that hasn't had to face a life-threatening disease has. They have that carefreeness about life, and I wouldn't want anybody to know what I've had to go through as far as having to experience it themselves. I wouldn't wish that on any human being. But when you have to face something that is trying to kill you, then you really think through, well, okay, what I want to focus my life on, if my days were numbered. You know, I guess all of our days are numbered, but you think
Yeah.
a lot more about, well, shoot, they may not be as long as I had hoped. So it's been a little ironic, and especially working in healthcare, kind of the anti-aging, holistic medicine space. It's been a lot for me to think through going through this cancer journey.
Right. I know I've read some other survivor stories, like one that survived pancreatic cancer, and he was saying that the little things in life that used to annoy you, like everyday things, that doesn't really matter anymore. Like it's
Yep.
insignificant. Like
Yeah.
you're probably more appreciative of what you have and less hung up about little nitpicky things.
Absolutely. I laugh a little bit, like when someone says, "Oh, I don't feel good. I'm sick. I'm gonna stay home." I'm like, okay, and that's fine. It really is. There are little things that are really important to me, like deep breathing, like pulling into my body fresh air. Just when I walk, my walking has been really helpful for me. like I mentioned, my spiritual life has been really powerful going through this, and I've had a total different type of dependency, and it doesn't have to be about me anymore. I think that's another thing that I've learned a lot. It's like I just want to be here. It doesn't have to be about me succeeding and doing all these things. Just I would just like to be alive, So it
Right.
really changes the way you look at things. You're like, I'm just happy to be alive. I'm happy to be here. One day I was on a walk and I was doing some, deep thinking, which you do tend to do when you go through something like this. And I had this bit of enlightenment, which if it wasn't for modern medicine, and I feel like God's mercy, I wouldn't be here. I mean, without, you know, conventional treatments and functional medicine treatments and my spiritual life, I wouldn't be here. So all these days are bonus days for me. I just call them my bonus days. Like I get to live a little bit longer
Mhm.
because 200 years ago, I'm out. I'm not going to make it with that kind of diagnosis. I don't think they had the treatments for cancer a couple hundred years ago that we have now.
Well, I guess the main takeaway I would say is get your screenings done by age 45 and then get on a regular screening schedule. So even if the first one's negative, you still have to keep going and keep getting them on a regular basis. A huge thank you to Tim for sharing your story and your personal experience. And
If I
it's
could say
great.
one last thing, Dr. Engels,
Yes.
do you mind?
Uh,
Because you said that I would probably say this. And I don't feel like I did, but what I
okay.
would like to say for the colonoscopy versus Cologuard, and please just do something, right?
Right.
Like if it, but first line of defense is a colonoscopy, right? Because what you don't want to have happen is have a Cologuard be positive because that probably means that polyp has turned cancerous. So it's smarter to go in and get the precancerous polyps removed so that you don't run that risk.
Mhm.
So that's what my recommendation would be. Just go and do the colonoscopy. Anything that's not supposed to be in there, they'll take it out and you're good to go. But the Cologuard's second line of defense is not going to show you as much as a colonoscopy would. So I don't think I realized that when I thought about the two. I thought they were pretty equal. So I just want people to know that they're not equal. They're two different strategies, but the colonoscopy is a better strategy.
Well, thanks everyone for attending today. As your doctor, I'm committed to keeping you healthy. If you're interested in hearing more about the preventive steps you can take against cancer or how to incorporate life-saving diet and lifestyle changes into your personalized treatment plan, please bring this up in your next appointment with me. And if you're new to We Care, I highly encourage you to sign up online on our website, wecarefrisco.com, to do the foundational assessment and then become a member. And that's where I can dive deeper and assess your risk factors and look at your microbiome and all that. So thank you so much for joining, and thank you, Tim.
Thanks, Dr. Ingles. Thanks for having me. Thanks,
All
everybody.
right. Thank you.